Hi everyone. Today you're going to hear from some of the top plastic surgeons in the country. Our panel of doctors are board certified and world-renowned in the medical community, known for their research and expertise. You're watching the Plastic Surgery Channel.
Thousands of women have breast augmentation surgery every year. Find out why nearly 20% end up with disfiguring results. Also hear from viewers like yourself as they ask their most personal plastic surgery questions. And later, find out what the celebrities do to keep them looking great. It's all ahead on the Plastic Surgery Channel.
Doctors, thanks for joining us today. Let's talk about how plastic surgery is depicted in the media.
Well, I think it's the wrong look. I think women are looking artificial, and it's almost become the new norm.
Well, yeah, I mean, TV is sensational, so I mean, part and parcel with being on TV is it's going to be the extremes, and, you know, it's a double-edged sword because I like the information, I like, you know, sort of plastic surgery coming out of the closet, but not when it's extreme and not when it's sensational.
I'll tell you, Brad, the one thing is there's so much hype and spin out there that patients, unfortunately, get the wrong message.
And when you mention that, Bill, there is a new reality show called Plastic Wives. It's about 4 women married to surgeons. Let's take a look.
Here in the land of that famous Hollywood zip code lives a group of wives. They are called the Plastic Wives, married to some of the most successful surgeons in Beverly Hills, and they get all the perks that come with it.
Breast augmentation. Who's had their boobs done?
4 times.
Everybody. 4 times. You win the prize on that one. Botox, love it or hate it?
Love it.
Bobo.
So what's your impression?
That's unbelievable. Maybe we should start with what's fact and what's fiction.
Well, look at the title. Plastic Wives. Are you kidding me? I don't know whose reality that is, but I spend my day trying to tell people why they won't look plastic.
Yeah, well, it's, you know, they call it reality TV, but it's not really reality. It's sensational TV, like TV always is. And so patients don't understand that, and they often think that this, all your wives look like this, and I think it's crazy. And there's nothing proud about having 4 breast augmentations.
I think it scares patients when they see shows like this and they think, oh, I'm going to go to my plastic surgeon, I want to look better, but they're really afraid they're going to end up looking like this. It's almost as if they're bragging. They want to have more done. And that seems like it's not reality.
This is so out of the norm. You know, we look at that and we just cringe. And as a plastic surgeon who has a wife who's also a plastic surgeon, if we sit down at night and we look at that, it's just laughable because that's not reflective of our practice and our patients and what we're trying to do.
Now we want to know what questions you have for our doctors. Each week we hit the streets to find out your plastic surgery questions.
Look at the results and think.
I heard a lot of men are getting Botox.
We're hearing a lot lately. I had my breasts done probably about 15 years ago, and I was just wondering when I should get them fixed or redone.
I'd say for starters, 15 years after breast surgery or breast augmentation is probably a good time to see your doctor. Your body changes over 15 years. Most of the warranties at that point are up, and it's really a good time to have a breast check. There are new implants out. Your goals may be different because you look different than 15 years ago. Your breasts have changed some. And so those questions need to be addressed between you and your physician. And once you've had a good examination and a good conversation, you'll know when the right time is to make an exchange.
You know, 20, 25 years ago, at 10 years, a lot of the implants were ruptured or leaking, but now the current implants are really different.
Yeah, the longevity of implants today are much greater. I think that 15 years is more about how your body's changed than necessarily how the implants have changed.
And the other thing is that although breast augmentation, breast implants are tolerated very well, there are some women that experience hardening of the breast or what's called capsular contracture. So if women are having that type of symptom, they want to see their plastic surgeon and have that addressed.
I surely don't want patients to fear their implants, and I think that just a periodic evaluation by the plastic surgeon is warranted, especially at 15 years, you should go in and see them. But surely if they're doing fine and they're still happy with their breasts, there is no reason that you necessarily have to change those implants.
Right.
They don't. It's not like changing tires. They don't, you know, per se have to be changed until there's a problem.
But if they do have a hardening of the breast, like you were talking, Dr. Adams, they will know that, and that is an issue that needs to be addressed, right?
Yes, it is, and you know that's been one of my areas of research focus for the past 15 years, and we've done several studies and published those, and what we learned is that capsular contracture, hardening of the breast, is caused by a colonization of bacteria around the implant. So The solution to that is a few things, but we have some antibiotic solutions that can be used during surgery to reduce the incidence of capsular contracture, also techniques where we're doing much different atraumatic bloodless techniques for doing the surgery. Those things have really minimized the capsular contracture rate. The difference of 25 years ago, the capsular contracture rate is probably over 50%. Now it can be less than 5%.
Yeah, I think, I like that Bill said the solution is solution, because a few years ago he published a very important paper using triple antibiotic solution in the operating room to irrigate the pockets to help reduce that capsular contracture rate. So all the things Dr. Adams mentioned, along with that good irrigation, can reduce that colonization and hopefully reduce that hardening of the breasts.
Our next question comes from a mom who has concerns about lip augmentation.
Well, I would like to have bigger lips, but I don't want it to look fake.
What do you think, Brad?
Well, I think that, when you think about lip augmentation, the ones you notice are the ones in the parties that are overdone. But what you don't realize is many of the people at the party probably have had their lips augmented, or at least at my parties at my house. And they look natural. You wouldn't know it. They just look great. They don't have the wrinkles and the lines around their lips.
Well, I think it's difficult sometimes because patients come in with the perception that whatever age they are, bigger lips are going to look better. And that's difficult. I think we have to educate patients on what looks natural and enhance their appearance and not look like, oh, who did your lips? I hear it every day. I see these little lines on my upper lip. And first of all, they have like a 10x mirror. They're looking at themselves at home. I'm like, the public does not see you like that. And again, I also tell them about just inflating a little bit, smoothing it out, whether you're using lasers to kind of take the shoulders off the wrinkles, a little filler to try to soften them. The goal is just kind of give a balanced, attractive mouth.
Seeing that picture, we all laugh about that because, as we all know, that is so common. How many times a day do we hear that exact question? And that's just not, we talk about volume and how to balance things and how to eliminate these lines and when we all get together, but the perception by the public is completely off of that because all they notice are the bad, overdone, platypus
trout
lips. And they think that we're producing those and we're trying to tell them, no, we don't do that. That's not, you don't notice the ones that we're doing.
Yeah, sometimes exaggerations, particularly on TV, are eye-catching and noteworthy, but they're the exception, not the rule. And I think we need to explain to our patients too, there's the aging lip, and then there's the younger lip that wants to be fuller, and they are completely separate.
Totally.
Taking an aging lip and overfilling it really looks awkward and unusual all the time. And what we've been talking about before is restoring what you once had is different than trying to enhance what you have or what you're given. And in lips, unlike many different things, those are almost two different worlds, and we have to be very careful. But again, as Brad said, that's not the filler. It's the conversation before the filler. It's the person behind the filler that makes the difference.
Up next is a mom who'd like to get her body back to the way it was before kids.
I have 2 children, and I was thinking about doing the mommy makeover, but is it okay to do my boobs and have my tummy done at the same time?
Great question, very common. A large part of my practice is performing mommy makeovers, as I think it is for many of us. Yes, it is, with a few caveats. The patients generally, like this patient, they need to be hopefully healthy, of normal weight, and then really the specific concerns in the specific areas need to be addressed by someone who really has a lot of experience in this. There are some really unique challenges with combining these surgeries, as we all know. There's been a lot of research in this area, but there's no general consensus, and so it's really, really important to find the people who have the experience in knowing how to do these and get you through these and navigate you through these combination surgeries safely.
And this is really more emotional than I think I initially realized. I mean, I just last week had a patient actually cry to me just of how much it changed how they feel about their body. And so sometimes we don't even see or appreciate how much they're bothered by the changes that occurred with pregnancy. And so following a lot of these patients over time, you really get to hear their stories and hear how much you've changed their lives. And so I think that's one of those incredibly satisfying things about our job is that we get to sort of change lives in a very positive way, and yet we keep them safe and we're really responsible for them and we protect them in a way that still achieve that for them.
It's exciting for our practices when we have a lady who comes in and you can tell they're just dreading it and they don't want to come in there, but they just finally drag themselves there, and it's so hard for them to get there. And then when they finally do and they're in the robe and they're just like, prepare yourself, doctor, because you've never seen anything this terrible, and and they show you and it's like, oh man, you're going to look great.
Dr. Wall, I know you've performed quite a few mommy makeovers in your practice, and recently you had a woman come in and she said that that surgery changed her life. Let's take a look.
Before my procedures, I was an outgoing person. I had no idea how much I hid until I had the procedure. I used to wear big shirts and hunch and hide.
Trisha had 3 procedures with Dr. Wall. Each surgery was not only physically changing, but brought about a psychological change as well.
I call her her. I feel like 2 separate people. I had no idea that I could become this person.
Before having surgery, Trisha had to make some big changes in her life. She quit smoking after 20 years, lost weight, and made exercise part of her daily routine.
And to this day, I can look in the mirror and I see somebody new. So it's more than a procedure to me. It was absolutely life-changing. I became more open to doing different things. I now compete in ballroom. I've been a dance teacher for 30 years, and I always stayed behind the curtain. And it wasn't until I changed my perception of me that I was confident enough to go on the stage. And now that I've been on there, I don't want to get off.
For every mommy makeover patient, Dr. Wall strives to make the procedures as tolerant as possible. He uses a long-lasting local anesthetic injected into the wound during surgery. This allows the patient to be up and walking sooner. He's also implemented a rapid recovery technique for breast augmentation. As for Trisha, she recovered quite well.
You just get a second wind. You get a second wind, and when you're on the top of your game, your family's on the top of their game, your children, it's all harmony. When you have that little extra something, it shows, and you portray it out to the world. I'm not hiding anymore. I'm not hiding anymore.
This is a great story, but explain to us, what is a mommy makeover? I think a lot of people may be confused. Can it be a combination of different procedures?
Sure, there's no mommy makeover per se. That's just a combination usually of some type of a breast rejuvenation procedure. You know, all of these people have had their children, they're done having kids. It's now time to try to regain that body, and so usually these are restricted to problems in the breasts and problems in the trunk, the abdomen, the tummy, the hips, all the way around the waist, and usually the arms and the legs are less affected.
So it just depends on the individual patient.
Right, that's the most important aspect of this, is trying to figure out the balance, what's going to look best for each individual body type, and it's about also preparing each patient for this. It's not like, okay, well, I'm ready for my mommy makeover. Well, you may not be. You actually need to get back to the weight that you want to live at first, because we want to, you know, this is a big procedure that we want to just do at one time and do it right.
If you have plastic surgery questions you want answered, make sure you follow us on Facebook and Twitter. Stick around, we have much more still ahead.
At the Wall Center for Plastic Surgery, our surgeons are board certified and have over 60 years of combined experience. The Wall Center is all about patient care and delivering the best outcome for you.
Welcome back. If you're still wondering about the popularity of neurotoxins and dermal fillers, the numbers don't lie. According to the American Society of Aesthetic Plastic Surgery, Botox topped the rankings of the most popular non-surgical cosmetic procedures. Brad, you do a lot of facial rejuvenation. Do you have any thoughts about what the top 3 things are that patients like?
Well, thank you, Christine. I think that, these are still procedures, and so I tell all my patients to expect some bruising, swelling. Don't have a big event the next night, just in case you have a little bruising and swelling, but it's quick recovery and, painless recovery for sure. I think importantly, too, is they come in usually complaining of wrinkles, and then I sort of have to look at them and sort of re-educate them about volume and shape, because I think facial aging is about a loss of volume. And so whether restoring volume in the lips or in the cheeks or in the nasolabial folds, wherever, it's about restoring volume, and that gives a restful, youthful look. You know, and I think lastly, I've been doing Botox for 16 or 17 years, and nothing can replace experience. And so for me, making sure that the patient gets the right treatment from the right doctor who knows what they're doing and has a lot of experience with it is the guarantee to having a better result. These products always work. They're great products. I use them myself. My staff use them. My family members use them. But only in the right hands can you have a great result.
So Brad, who do we have that's joining us today?
Well, this is Gail, our volunteer today, and she and I have already had a discussion about what she would like to see improved. And so as we went through, she doesn't like the 11s between her eyebrows. Also, you know, the forehead line she's a little bothered by, and also the crow's feet. And so we'd like to address all of those through use Botox. You could use Dysport as well. But more importantly, when I think about using a toxin, is that I can actually change the shape of her eyebrows and in her forehead. So where she's talking about wrinkles, I'm thinking, how can I recontour and how can I make maybe the brows go up a little bit and give her a better look? So we're planning for her to do Botox a little bit in the central forehead, into the 11s, and then also a little bit into the crow's feet. This should give her a nice brow elevation, help her with the fine lines and wrinkles that she doesn't like. And so we're going to start there. So these are the Botox injections. This is into the 11s. And these injections are very, very quick, but very precise. We're going into the muscle called the corrugator. And then I'll also do an injection, you know, in the area that's between the eyes, the frowns as well. And that's how quick it is to do this injection. She would like to have slightly fuller lips, but she also would like to have a reduction of the wrinkles. She definitely does not like the parentheses around the mouth. We call them nasolabial folds. And for me as a surgeon, I see the loss of volume in her mid-cheek and their submalar region, the area below the eye extending out to her cheek. And I know that if I add volume there, it will give her a more restored, youthful look, more restful look, but also it's going to soften the folds that she doesn't like, called the parentheses. So we're going to use Juvederm. It's a hyaluronic acid. It does great on the fine lines. It actually is going to restore volume. So think about this as initially restoring volume. So I'm going to start here, Gail. So it's going to have a little sting to it. And the lips are a little bit more, you know, tender to treatment. Fortunately, these days, these products have lidocaine in them. So they have numbing medicine built into them. And that's just recent over the last year or two. So once you start to do the injections, some of the numbing medicine is present in the product and it starts to make it much more tolerable. So as you see, I'm moving along the lip line initially. We call that the vermilion border because I'm trying to just give more definition to her lips. This is an area where patients complain that their lipstick goes up into the lines, and they get bleeding into the lines, they don't like it. So I think if I strengthen that fold without overdoing it, it can be excellent. If you overdo that fold, then it looks very unnatural, and that's the person that looks like they've had an augmentation of their lips that they don't like. We definitely don't want to create a ducky look. Next for Gail, we want to restore cheek volume, which will help with her nasolabial folds, these parentheses around the mouth, as well as just give her a more youthful volume. And so we're going to do that with a product that I use that's called Radies. It's a calcium hydroxyapatite. It's a little thicker product, so it's a product that I would actually use only in deeper areas of the face. You ready? Mm-hmm. Okay.
So as we age, Brad, what actually happens? What do we lose? Muscle, collagen?
Well, I'm going to tell you, you lose a little bit of everything, muscle and collagen and fat, and you lose volume. And in the face, you lose bony support a lot. And that's where this can come in. You lose a lot of the bones just get smaller. If you look at dental x-rays, you see there's less bone present. And with that, we see a deflation of the soft tissue overlying the bone. And I think that is enough for one day.
Mm-hmm. You look great.
And but not overdone at all. I don't think anybody would look at you and think that anything's been over-injected or overdone. You'll be surprised how much volume you can actually tolerate and still look excellent. And we did it very quick. I mean, you know, even doing this as an example, I think maybe in just 15 minutes or so, we've given you a lot of volume, a lot of restoration. How'd you do?
Not bad.
Not bad? Are you
Not
glad
bad.
You're glad it's over, right?
Absolutely.
Yeah, exactly. Okay.
If you would like to learn more about facial injections, head to theplasticsurgerychannel.com. Coming up on PSC Uncut, our docs debate the hottest topics in plastic surgery today.
Discover surgical and non-surgical options at the Wall Center for Plastic Surgery. Our board-certified plastic surgeons have over 60 years of combined experience.
Fat grafting to the breast. It sounds too good to be true.
You know, fat grafting today is almost revolutionary. It can do things in terms of fixing breast implant issues, replacing breast implants in certain situations, and even fixing breast reconstructions at a level that we never could do before.
LB, I love you, but I'm telling you, we have failed miserably on this topic. And the reason is because we had people for 3 to 4 years telling everybody that fat grafting was going to replace breast implants, and it is not. We had no data to support that hypothesis, and it went on, and finally all these people that were claiming it was going to replace breast implants have come around and said, oh, well, actually it's not going to replace breast implants. So I think we did a disservice to patients for the past 3 to 4 years in propagating that notion. There may be a place, but bottom line, brother, is not going to replace breast implants.
Well, here it is, Bill. The past is the past. We're talking about where we are today. And now there is good data. People are doing good studies. We have MRI studies, we have growth studies, we have long-term studies that show that in its place, we can identify patients who, number one, can have their implants removed if they're having problems replaced with fat, can have fat used to improve their results with implants, and can make reconstructive problems better as well. Fat can do things that no tool we ever had could do before. And going forward, you're right, we're obligated to look at it carefully, but I think that ball is rolling.
And I'm going to give you some kudos because you're one of the primary people that has done a lot of that research, and I commend you for that. And I think that's the stuff that we need. We need data. We need to have good information and base decisions off of. And I agree with you. Soft tissue coverage is the most important thing for a breast implant. In fact, probably does have a place in combination with implants to provide that.
And we're obligated to do it better. And I know you raised the bar on that, and we'll continue to keep trying.
If you'd like to learn more about fat grafting to the breast, log on to theplasticsurgerychannel.com. Look and feel your best. At the Wall Center for Plastic Surgery, we make patient care our #1 priority.
The science and technology that's available has transformed the cosmetic surgery industry. Let's take a look at the top 5 non-surgical procedures.
Most of us try to look our best as we age. Age-defying procedures that once required surgery can now be accomplished with very little inconvenience to the patient.
Patients want non-surgical things. Patients want no downtime, no pain.
I'm a mother of 3, and I cannot imagine taking time off for surgery.
Last year, consumers spent more than $3 billion on non-surgical procedures, and plastic surgeons are taking note.
We as plastic surgeons really need to embrace the entire continuum or spectrum of facial aging, and that includes non-invasive.
Currently, non-surgical procedures account for 80% of all plastic surgery. Here are the top 5. Botox for frown lines, dermal fillers to treat creases in hollowed areas, IPL therapy for sun damage and hair removal, and for the body, cool sculpting, a non-surgical way to remove fat. And finally, Ulthera, ultrasound therapy used to lift and tighten the skin on the face and neck.
It's going to be like a pyramid, where people are going to have their non-invasives first because the recovery is less. It's easy to do that. Later on in life, they need something more, then they will move up that pyramid and have their surgical procedure.
I'm looking into Botox or fillers, and then later in life I might choose something more permanent.
In the somewhat not too distant future, I can see us replacing a lot of plastic surgery procedures with non-surgical things.
What can we learn from celebrities and their plastic surgery, whether it's good or bad? First up is Jennifer Aniston. What do you think?
I think she looks great. I think she's a perfect example of someone that's had maybe a little bit of work done, maybe to her nose, to look prettier.
She looks too fabulous not to have done something, but you can't tell what it is. And I think that's the magic of having good procedures done, whether it be surgery or non-surgical, and I think she looks great.
Right. I mean, she's just a great example of this. You know, is it good plastic surgery? Is it good whatever? We don't even know. We're all plastic surgeons. We do this for a living, and we just know that she looks fabulous. You know, she might have had some things. I think it's probably evident that she's had a rhinoplasty. She's probably had some filler, but again, we're speculating, and all we really see is someone who really looks beautiful.
Here's the dangerous thing about Jennifer Aniston, and I would tell you, I think she's the prettiest. But if you look at her carefully, people want to mimic her sometimes. She has a really strong jawline, almost an extra strong chin, almost extra strong cheeks. And in her, it's wonderful. That's the problem with celebrities, because your other average patient wants to come in and have those exaggerated views. They could look just downright terrible. And that's why I think also we always get wary when a patient comes in and says, I want to look like so-and-so.
Right.
That's a red flag sometimes. But Jennifer Aniston is a great example of great plastic surgery.
Dr. Adams, take a look at this. This is the Barbie doll model. What do you think? Extreme or no?
I think it's just a very natural look, and you know,
exactly.
It's great.
Yeah.
No, I mean, come on, it's a joke, but this is kind of everything that you fear about unnatural plastic surgery. It's not the norm that any well-trained plastic surgeon would try to strive for a patient. There's also some issues with the patient's perception of their body image. Brad, I mean, what do you think?
It's scary. I mean, it's scary.
But she is getting a lot of attention.
Yeah.
That, I think, is the point.
But the problem is it kind of brings our profession into promoting that unusual look, and that's difficult.
If she's walking down the street of Louisville, Kentucky, where I practice, I can guarantee you nobody's going to see her and run to my office. Nobody perceives that as a great job, and so obviously it's just a fringe type of procedure, a person.
Now let's go to Heidi Montag. She's been big in the news about having a lot of regrets, and it's obvious she's had a lot of procedures done. What are your thoughts?
Well, I think her breasts are too big. I don't think they fit her body, and I think there's some long-term consequences of this.
Well, she's made celebrity out of having plastic surgery. That is her celebrity. And so in some ways it has to be extreme to make it celebrity status or worthy. And so, you know, she does everything too extreme, and there's going to be a long-term consequence for her, and she's starting to experience some of that regret now.
It sends the wrong message, you know, to 16 surgeries. She's never going to be able to correct that. You know, long-term, she will have horrendous problems that she'll have to deal with. So it really sends the wrong message to patients, and it's unfortunate that the celebrityism part of that propagates that message to patients.
She's lost the youthfulness to her face. She almost looks older and more angular and unusual.
Yeah, and we all know what she's going to look like 10 and 15 years from now. When you've had 16 surgeries that young, there's a price to pay. And we have to look down the line and say, what's going to happen to this patient if we keep operating on him?
But now, 2 years later, she says she regrets all the surgeries.
Well,
McFly.
We're not that surprised. But our message is to other people is that much surgery that young cannot be a good thing.
You know, I constantly deal with my friends who think I'm like there to sort of evaluate everybody, so they're constantly asking me, are those real, are those not real? We all, and I'm sure, get that and we hear that. You know, and obviously, the ones that are obvious we notice, you know, and I can say, sure. But, you know, many times they probably do have breast augmentations, and I just don't know it. I can't really tell. Those are the great ones, you know, and those are the great ones, you know, and I think that everything else beyond that's extreme and has a long-term consequence.
Thanks, Brad. Thanks, doctors, for being here. You're watching the Plastic Surgery Channel. If you'd like to learn more about plastic surgery, log on to our website at theplasticsurgerychannel.com. See you next time.
To find a board-certified plastic surgeon in your area, go to theplasticsurgerychannel.com. Find us on Facebook and ask your plastic surgery questions.